Everyone in healthcare has a story they never forget. Some are beautiful, some are difficult, most are never told. This is the space and place where doctors talk about moments that change them. Welcome to HUMED, where we talk about the emotional, moral, and human realities of medicine. I'm Dr. David Spiro. Thank you for being here. Please hit subscribe wherever you get your podcast information. I'm incredibly delighted and honored to have Dr. Masoud Saman on with me today. He is an internationally recognized double board certified facial plastic surgeon. He specializes in rhinoplasty and facial rejuvenation. He's also the author of The Smart Guide to Rhinoplasty and has published extensively in peer-reviewed medical journals. He's trained internationally and known for elegant, natural results. Dr. Saman combines surgical precision with an artistic eye refined over years of innovation and mentorship with leading surgeons around the world. Before entering aesthetic surgery, he began his career as an oncologic surgeon, treating cancer patients with complex facial cancers and injuries, an experience that shaped his ethical, patient-first approach. During this period, Dr. Saman trained intensively in oncologic resection and facial reconstruction under renowned mentors and developed a lasting belief that surgery is a technical practice, but more importantly, a human art focused on restoring dignity. I love that. Beyond the operating room, Dr. Saman is a father of 3 daughters and a vocal advocate for healthier, more honest standards of beauty, speaking out against filters and harmful skincare trends targeting children. Dr. Saman, welcome to the podcast. I'm so honored and pleased to have you join us today.
Thank you, David. The honor is all mine. Very, very excited. I've been looking forward to this.
So tell us a little bit. We had met briefly a few weeks ago. I think it would be interesting before you mention your story to tell the leaders a little bit about your nonlinear path to where you are today. I think it's fascinating.
Absolutely. Nonlinear is absolutely correct. I had no idea that medicine was in the cards for me. I don't come from a family of doctors. In fact, growing up, going to the doctor was this whole ordeal where my mom would make sure that I'm dressed properly and that if it hurts, that I say nothing and just kind of deal with it because of the respect for the doctor. And it wasn't something that I ever thought I would become. So I grew up in Iran. Just a shout out to the people, by the way, for all the protests and the perseverance against the dictatorship regime right now in that country. And I left at the age of 15. I left exactly for the reason that they're uprising now. At the age of 16, you get locked in as a male to be in obligatory military service. I came to the United States. My uncle was in Dallas. And we just came with very little money in my pocket. I think about $300 is what they had given me to bring and just kind of figure it out from there. And, we come from a middle-class family background, but taking money out of the country was not legal. And also the exchange rate was so unfavorable that my dad would have to sell a house, for example, for a month of my rent in a modest apartment here. So I brought some money out and I came with a determination and an objective, and that was to make someone of myself. This is what my mother said to me as I left, as I was leaving in the airport. She said, "We don't have a lot of monetary capital, but you have a good brain on your head. Do something good with it." So I arrived and worked all sorts of jobs, Wendy's and sacking groceries, and I worked at a print shop, and I worked construction, and I'm only 5'6", and jackhammer would come right in front of my face. So that I would go home still shaking at the end of that. But whatever job that I could work to make ends meet, so that I could go through high school and college, etc. Somewhere along the line, first year of college, this website came out. You may remember Priceline. They're still in business, but they had a very interesting model, which was you would enter a bid for a flight, and if the airplane hadn't filled up, then you had a chance to win. And I entered a bid to go from Dallas to Paris, because why not? My parents weren't here. If anything, I was closer to home. And it took for $300. And
Wow.
I just packed my stuff and my guitar. I was dabbling in a little bit of classical guitar and some chords, and um, initially started to meet girls, but then I fell in love with the art of the guitar and the music, and specifically flamenco guitar. So I started taking some classes and stuff. And I took my guitar and I went to Paris. It was a connection in Atlanta, and I went to the Chinese food counter to get my food, and somehow I left my wallet there. So I got back on the airplane, and no money now. And here we go to Dallas. I had a la old school, $100 bill stuffed in my sock. So that came to rescue a little bit for the first day. Luckily, I had prepaid the hostel. I showed up to the hostel and passed out. I was very, very, very tired and jet lag and everything else. As I woke up, there were 3, 4 guys singing and dancing in the room really loudly, as if I weren't there. And I opened my eyes anyway. Long story short, we became friends, and they were also, well, I can't call myself a musician, but they were musicians, and we decided to form a band. The eventually became it was three. It was me, a guy from Algeria, another guy from Germany, and we, the Algerian guy would sing stuff at the outside of the metro station. I would play the guitar, and the German guy would play the drums. We had my guitar case open, and every 20 minutes a train would stop. 60, 70 people would exit. Each of them would give us maybe a euro. The euro was brand new at the time. And at the end of the day, we had enough for a bottle of wine and a couple cans of tuna and some bread. So that was what I did. And I fell in
Wow.
love with languages. I was enrolled to take classes at the Sorbonne University in humanities, philosophy, and French language, and I did that, and it was fantastic. The story continues, but fast forward to when I came back, just out of nowhere, I found a job at a hospital. Never ever had worked in healthcare, never had seen what healthcare is like. And this is Medical City, Plano, and in one of the suburbs of Dallas. And I got a job there, unit secretary on the 5th floor orthopedic section. And I would sit there, and the doctors would come throw these old charts with the binders, the binder like, and then I would have to enter the orders. Got really good at reading the handwriting there, and there was a doctor, neurosurgeon there, who took a liking to me, and from time to time would explain what's going on with the patient or why they're the way, and it just sparked this interest in medicine in me.
Mm.
Me and my then girlfriend, now wife, would go have coffee sometime afterward because we were too young to get a drink. And we would sit at the coffee shop and talk about how awesome would be if like we went to medicine, if it were possible. And she would say, why isn't it possible? I say, I don't know. You have to come from a family of doctors. You have to have money. You have to have this, that. And little by little, this dream became a goal. And I just started taking science classes. And I don't know if I fell in love with the sciences and that's why I got good at them, or if I was good at them and that's why I liked it. I don't know, whatever combination in that time worked out. And it worked out such that I became very interested in applying realistically to medical school with hope. And I did that, and I got in and started this whole journey. And
Wow, that's a tremendous story. Before we get to your story, there is something that really, the whole story is really interesting to me, but the spark seemed to be about this engagement with the neurosurgeon, who we could call a mentor and a guide and someone to aspire to. What what did that mean to you? And I read from your bio, and the little I know you, you seem like you would be an awesome mentor. And I'd love to hear a little bit about your perspective about that gentleman and how that affected you, and also how that has affected you being a mentor to others.
mentorship is everything. It's is everything in life, especially in medicine, because medicine is one of those old school crafts. It's not all the most recent pathway or enzyme or the most recently discovered molecular event. It is this chest to chest apprenticeship, old school things that require a big time human side. Because when a patient says, I'm just not hungry. You have to really think about, is this a defiance thing? Is this cancer? Is this a parasitic infection? Is this a mental disorder? Is this whatever? There, you have to just read so much more than what's on in the books. There is a lot there. And this is a simplified example. Of course, there's so many complex situations of life and death, and also well and not well in medicine. So Dr. Louise Magnucci was this neurosurgeon, and I felt for the first time seen in the healthcare world.
Mm.
It's so busy. You sit on the orthopedic floor, somebody's being rushed down the hallway to surgery. The nurses are speaking in lingo that you don't necessarily understand initially. The handwriting you can't read. You're trying to figure it out. Everyone's busy. Everyone's doing more important things than the quote unit secretary, at least seemingly to you as the unit secretary. And for the first time, I felt and was seen in that setting by this neurosurgeon. And it made me feel like, oh, maybe I can too, because that's what he said.
Mm.
He was from Puerto Rico, kind of a similar story, and he came and became a well-known neurosurgeon in the DFW area. Funny story is that 20 years later, we did several cases together. Um,
Wow.
yeah, because
Wow.
that same. So it's David. 20 years later, on February the 4th of 2015, my first daughter was born. When she was born, we received this big. I had just finished, or I was about to finish fellowship. No, I had just finished fellowship, and we received this big bouquet orange flowers. Congratulations on your new bundle of joy, etc. By the way, my name is so and so, CEO of this hospital, that hospital, Medical City Plano, and I'd like to meet with you about a possible opportunity in head and neck cancer center of excellence, establishing that. And so I was very excited. I had interviews with different hospitals and private practices and things like this, but I was very excited about this. I went and I met with them and spoke with them, and their plan was to bring me on as the head of head and neck cancers and facial trauma and create a program to be the largest in North Texas. That was the big plan at the time, which we ended up doing, but it took longer than expected. And when the conversation was over, the vice president of the hospital took me on a tour. And as I go on the tour, when I get onto the 5th floor, somebody yells down, "Hey, Masoud, Masoud." And I turn around. Sure enough, it's one of the nurse assistants from back then who still stayed on that same floor 20 years later. She ran up to me, gave me a big hug, and the vice president of the hospital was confused as to what's going on and introduced me as the director of head and neck cancer for the hospital. And she was also confused on what's going on. Full circle moment. Um,
Wow.
so as the head and neck cancer, there was a skull-based patient that we operated on, and I got consulted on this patient to go through the nose because this tumor was through the clival base and coming out. And for my job was to create access for the neurosurgeon to go get this out. And the neurosurgeon attending of record was Louise Magnucci. The first case I did with him was that skull-based case. And when I walked in, I didn't tell him. I knew there's no way he would remember my name. And sure enough, he hadn't. And I walked in and I told him the story, and he remembered. And this
Mm.
is just, it was a most amazing story. Then we did several things, cases together later, but that was a beautiful moment.
That's
Mentorship is
really
important to me.
it's
Uh,
not only just important, it's like I find it to be beautiful because I think we've talked about mentorship on the show in different realms, and when it's done well, it's bi-directional. Someone gets out of it, and I guarantee that it was an honor for you, obviously, as you've explained it, to do a case with him. But I'm sure that he must have felt some incredible gratification that he had a role in 20 years later getting you to that point. So,
I'm sure of it. I mean, it was just this electric moment that neither one of us really had anything to say, just kind of try to take in that moment.
yeah.
I do mentor medical students and residents and even fellows. Fellows I don't mentor so much. I guess I mostly am technically involved in their training, but residents and medical students are much more open to mentoring. Fellows have already found their way. And sometimes I talk to medical students and it makes me remember how excited and fascinated I was with everything, and just how medicine was this. Every show I watched on TV had to do with medicine, and Grey's Anatomy. Everything was medicine. I was so excited. I would sit there as a medical student and I correct the scene on a show and say, "Oh no, actually, it cannot be like this." This excitement, then you then codify it with rules and equations and formulae and things like this. For a long time, as a medical student, even early resident, this. I thought I had to be this black and white person. That, oh, your LDL is normal, then you're not at a risk of cardiovascular disease. Um, this, therefore that. And whenever you have this, therefore that, humanity's lost. The poetry is lost. Because there's never A, only B. It could be A, any number of wiggles around before we get to B, if we ever get to B. When just a few years ago, this article came out, was it New York, England, New England Journal of Medicine, or I don't remember. It was one of these high impact factor ones. And the article was, serotonin reuptake has nothing to do with depression.
Hmm.
And it was this moment I turned around and said to my wife, look, we are fed these stories that are parts facts. Lab whatever in Arkansas discovered this thing, and then lab B found the correlation with this, whatever. And then we make up a story. And there's so much of medicine we don't get. Doesn't
It's
matter
interesting.
how advanced we get. All of it at the end is you and me sitting in front of each other. That's medicine. And you telling me your story and I tell you my story. In this case, we're colleagues. But if one of us is in a vulnerable position and comes to the other for that help right there, that's medicine.
Yeah, what comes to mind is when my first day of medical school, the dean of the medical school came in front of the class and said 85% of what we're going to tell you is teach you, and you will learn is either wrong or will be outdated in the next 20 years. And at that point, I thought he was out of his mind,
Right.
and he was actually correct in retrospect. So
Yeah. As a med student, you memorize all these relationships and correlations and all of these cycles or whatever. By the way, now it's been about 15 years. I still haven't used the Krebs cycle in my daily life. But beside the point, all these cycles or whatever we learn is a way of saying, I got this. I believe I learned something about this story of how the human body works. That's a level of advancement, finding independence, maturity, finding confidence as a young doctor. But I think the next step is not unlearning, but realizing that that is a very incomplete story. And the rest of us is here in that connection.
that's why I started the podcast, and I believe that to be true. I just talked with one of my colleagues about a case of a child who passed away from getting an infant, a 1-week-old infant that was bit in the skull by their family pet and died, and came to the emergency department essentially non-viable, but still technically alive. And the most important thing he did was not anything that was medical, but it was the connection that my colleague made with the family that was the most important thing that he did during that visit. I want to get back to your story. We intentionally went off script to talk about your interesting background, and I knew this conversation. I was been looking forward to this interview for a long time. So what is your story? I would love to hear a little bit about what story you would like to share with the audience today.
I have a story picked out for today, but I want to start by saying that I have so many of these stories, like many of our colleagues. I worked in the most advanced cancers and life-threatening level 1 trauma and all of that. Every patient that comes in front of us comes with a story, not just a diagnosis. And all of these stories are human, intense, and make us realize that we are vulnerable. We
Mm.
are uh, impermanent. And the story I have today for you is starts at about 2 in the morning, as I had just put my 6-month-old to bed again, and I come downstairs to lay down next to my wife, and my phone goes off. Dr. Saman, this is nurse so and so from the emergency department. We have a patient who shot themselves, 18-year-old male, from underneath the chin, and the entire face is destroyed. But so is the brain. So no need for you to come tonight because we don't think the patient's going to make it. So, okay. Why don't you think the patient's going to make it? Well, there's severe cerebral edema, um, but the bullet did not go into the brain. Neurosurgeon's going to go see the patient. I said, okay, I'll call the neurosurgeon. I stayed in bed for about an hour trying to fall asleep, having heard this, but how do you fall asleep when you hear this kind of a event at 2 in the morning that somebody just shot themselves? Don't come in, but we need your services. So I couldn't. I got up, I got dressed. I said, I got to at least go see this. And I show up to the hospital. The neurosurgeon's in the room. The patient had been transferred already to the trauma ICU. There's a bunch of nurses in there putting in different lines, putting in different monitors, doing handoff, etc. The mom and the dad are in the corner. The dad is solemn. The mom is crying. And I go in, I introduce myself, and I said, well, we'll see how things go. My name is Dr. Saman. I'm a facial trauma surgeon. I think the minimum we need to be doing is to take this tube out and put in a tracheostomy tube in the next couple of days as the swelling starts to go down. My way of saying, if you heard that he's not going to make it, maybe he will. Okay, kind of in a roundabout way. They said, thank you, etc. I left, went home, 7 in the morning. I went back to the hospital to do my rounds. I see this patient along with my team. And the nurses told me that, oh, yeah, no, he's doing a lot better. He's fighting against the vent, and he has some responses. Okay. Great, 18-year-old male. Anyway, let me fast forward that he became a good candidate for facial reconstructive surgery after the swelling of the brain went down. I performed 14 surgeries on this young man. He had shot
Wow.
himself from here. Last minute, he got scared and pulled his head back. The reason he shot himself was because his girlfriend had broken up with him, and he went in the ranch and shot himself. And can't really pass judgment on a situation like this, because at that age you're so vulnerable and you romanticize these types of things. And then I don't know the background and all of that, but I heard that and I was just very touched. And he went back, and the bullet went through, destroying his entire jaw except for the condyle area of the mandible, entire maxilla, tongue, floor, mouth gone, entire nose gone, and the bullet had come out in between through the frontal sinus. Luckily, he had a well aerated frontal sinus, or else it would have gone to the brain, and it came out. One of those things that you're like, how did you survive? So we go in, surgery number 1, I put a tracheostomy, come back, surgery number 2. We recreate his floor of mouth and mandible using a bone, the fibula from the leg, along with the artery and the vein, because of course we need the artery and the vein for the blood supply. And then we have to shape the bone to the jaw, and then connect those in a microvascular technique under tiny, like 9-0 sutures under the microscope. And so did this, put him in the ICU. This worked. Later, we put implants in that. Then I had to make his tongue, another surgery, using microvascular technique, tissue coming from the forearm. Later, you fix his nose. There was nothing there. It was just a hole, the piriform. And take rib, create the bony framework, and flip a forehead flap and inside lining with a different flap, and just a lot of, not to get too technical about it, but just a lot of very intense, very long, very challenging, but also very uncertain surgeries. These are the types of surgeries you do, and then you just kind of sit like this for about a week, hoping that it takes. The blood supply is okay. There's no coagulation within the anastomosis, etc. So every day, seeing them several times a day, getting to know the family, they're getting to know me. We're becoming friends to the point that, dad had bought some fries. He invited me in. We sat there together and we're talking and eating fries out of the same that kind of relationship.
That's wonderful.
And And as we go along, he finally at day 44, 45, got discharged, and went back to where he was from, which was in just close to Oklahoma. He came and saw me once a week throughout this. I had to check the flaps. I had to check that things aren't falling apart, especially leakage of saliva into the neck is very possible, causing problems with the carotid. So all of this stuff was happening, and he had this sense of humor over, time that I saw. Initially, he was very, very depressed. We got to know each other, talked about girls and why would you do this? And like, I'm giving him older brother kind of advice and so on. And then we lost touch. COVID had happened. This is 2-3 years after the incident. So 2017 is when I got the call, and then 2000 is when we lost touch. And he came to me and he said, in the middle of 2020, sorry that I haven't come in. I've just been in this deep depression, but every time that I think that it's not worth living anymore, I think of, what all we went through, and all this work shouldn't be in vain, etc. I said, why are you in this depression? He said, look at me. He said, yeah, I have a jaw now, I have a nose, I have a this, I have a that, but I can't go out to the grocery store without being stared at. I can't, like, how am I living? How am I going to live my life? The mom immediately interjected and said, no. I remember this, that she was trying to stop him and correct him. No, you look great. Why do you say that? It's not about that. Go thank God that you are living and you're not dead, and etc. And at that moment, I thought about this concept that reconstruction alone is nice. Life-saving, yes, it is. Did I save his life? Maybe. I think pretty close to it anyway. But life-enhancing, it wasn't. I put, this big tissue inside his mouth. The tongue is sticking out. Everything's there technically, but it's not aesthetic. It's not something that he can present to the external world as an 18-year-old, at the time 22, 21-year-old man. And I thought to myself, wouldn't it be nice if we could do aesthetic reconstruction, if we could do a reconstruction that actually looked good? I had been lucky enough to be trained in both head and neck and trauma and facial aesthetic surgery. And I said to myself, let me, over the next year, create these changes. Let's go back to the operating room. Let me, now that things are set, do some refinements, etc. I think this will help you. And over that period of 1 year, we did a lot of things: debulking of the tongue, the area where the incisions were, we kind of pulled so it kind of falls into a crease. The nose, we debulked it, put some grafts, made it look nicer. And all of these things that some say, oh, it's just foo-foo stuff, got this man out of that hole, that dark hole he was, over the course of the year. And then I moved to New York. I passed him off to a colleague for continued care. He never went. He ended up having an ENT somewhere up in Sherman, Texas. We're closer to him. And we lost touch. In November of this last year, 25, I come every day. My staff brings the mail and puts on my desk. Usually the first one's IRS, so I don't open it for a week because it's never good news. And then as I open these and I go through it, there's a card, and I open this card and it says, his name is Dalton. I'm allowed to share it. Dalton, and somebody's wedding, you are invited. And I look, and he's invited me to his wedding, wow, which will be in May, and I'll be going. With that girl. So they're getting married, and they've been together since, and this amazing thing. But I went through 4 years of, what I went through doesn't matter, because what he went through is much bigger, but I'm giving you my perspective. I went through, don't come to the ER, he's going to die, to going in there and us little by little reconstructing him, the life-saving portion, and then realizing that is nice, but he falls into this deep depression, and then try to get out of that through surgeries, but really through humanity, because those surgeries didn't make him look normal, but it did make him seem better, but also realize that people care that he's feeling this way, that people see him. And it's like you're at the bottom of the well and somebody throws you down that rope.
Mhm.
Yeah, it's hard to come up. It's not a piece of cake, but at least somebody sees you, you're looking, and you got somewhere to go. And that's what happened with this young man. And he sent me this card. So,
That's
yeah,
incredible.
yeah,
That must have really moved you, and
yeah.
being able to go to his wedding in May, I'm sure that's going to be a tremendous event.
I'm looking forward to it, and it's yes, it moved me, it touched me, it made me feel. I'm a touchy feely guy anyway to begin with. But this kind of thing is just definitely. I was never the big bad surgeon. I was just always the kind of the other one. But yeah, I loved getting that. I have a lot of these, by the way. I have so many letters and cards and Christmas and this and that that still come. I mean, people are so loyal and faithful and nice. Yeah.
So I'm now in my 30th year ish of I don't want to date myself too much of practicing. And when I still work shifts in the pediatric ER, and I love taking care of kids and mentoring. But to me, it's less about the medicine. And I'm curious about your perspective about this. So for me, it's less about the medicine, even though I enjoy practicing medicine and I enjoy teaching procedures and taking care of sick kids. But to me, the piece that makes me happy and fulfilled in my work at this point in my career is just engaging with families and making families feel more comfortable in an uncertain place, and having that connection with
I
families.
mean,
And
yeah.
from your perspective as a surgeon, is that what is most important to you? Is that connection, or is it because surgery is different, right? Because you are technically proficient surgeon that transplants fibulas into mandibles, and you have all this technical knowledge. So what is the most satisfying part of the work that you do? Is it the relationships that you have, or is it the surgery, or is it a combination of both?
It's evolved over time. Initially, it was purely technical. It was the patients were the attendings patients. We didn't really know them beforehand. We barely got to follow up. You would be on service and then you would move on to another service. So the win, the success, that good feel inside that you would feel had to do with technical success. A flap survived, or a cancer was fully resected, or a neck dissection was done well. And that's good. That's how it should be. You have to become extremely proficient at that. Um, and then the human side starts to show itself. Hopefully, at some point, every physician reaches that level of expertise in whatever it is that they're doing, that at the risk of using this word, that their job, the work portion, the technical portion becomes routine. And that's the hope. Hopefully everybody gets to that point so that then the poetry can start, the humanity of it can start. Um, I worry if I see a physician 40 years into practice and they're still super excited to go over the differential diagnosis. But I don't worry if a 25-year-old is doing that. That's great. 25-year-old doctor should be doing that, going over this differential, that differential. At 60, your differential should be 3, 4 things, and not that exciting to you, because now the excitement should be related to the healing, not just the treating. The treating is easy. Elon Musk the other day said something in relation to that, that nobody should go to medical school anymore because ChatGPT and robots and other AI platforms will be able to do a better job. Well, I couldn't disagree more. I couldn't disagree more. You can feed all that knowledge Absolutely. And yes, you can implant a small microscope, a small microphone in a stethoscope, and that a microphone could transmit the sound into an AI platform and give you even better than any cardiologist technical information and provide an excellent treatment plan. But medicine is not about treating, it's about healing. And those two things are not the same. The difference is a poetry. And if you don't understand that poetry, then yeah, sure, you can think of yourself as a robot. But if you do believe in it and you understand that the human soul also needs attention, then you're a doctor. Then that's the difference for me.
Hmm. You had mentioned at the beginning of the podcast that you're from Iran and said something about the protests that are happening now. Do you have a hope to, I don't know what medical care is like in Iran, and I'm assuming that there aren't many people with your training and expertise. Do you have a hope one day to go back and potentially teach the things that you've learned to other colleagues in Iran?
Um, yes, I would love to go back to Iran. I cannot wait to see the Islamist dictatorship fall, and I cannot wait to all of us watch them pay in accountability to what they've done to the beautiful people of my land. But to go and teach would be an honor. But that being said, David, I've at many conferences met with so many amazing and talented and capable surgeons uh, in Iran who train abroad or even train within the country that are outstanding technically. There's not a whole lot of
Hmm.
new things that I can teach them, but I would love to be a part of the medical, world in that country for sure. It would be
That's really
lovely to
interesting.
show my streaks at my elementary school to my kids. The only country in the world that I'm afraid to go to is where I was born. Isn't that crazy?
That is crazy. Well, I'm imagining that there are so many reasons why, as you mentioned, to bring your children and your family that you have now, your beautiful family, to the place where you were born, and for them to experience that kind of culture. And I'm sure you have relatives and family
Yeah.
in your home place where you're from.
We sure do, and it's home for me is very equally between. They say born in Iran, made in the U.S. I mean, that's exactly my life. I've been here 30 years, um, and I love it with all my life and everything that it's given me. But there's a nostalgic part of me that still loves the streets of Tehran, the smell of the food, um, the being hustled by the guys in the bazaar. I mean, all of that stuff just so awesome.
And the
I hope
history
my
is so rich because Iran, previously Persia, was at many points in our history the center of educated civilization, art and
yeah,
culture, and Persia was sort of correct me if I'm wrong, but the center of a lot of what was happening hundreds, if not thousands, of years ago.
absolutely. I mean, we this is a land where you have Persians, Turks, Baluchis, Kurds, and so many different ethnicities that live under one roof on one soil. It's also the land of Avicenna and Rumi and Khayyam and where algebra was born and just so many things. And the Greeks have very important other things. The Romans, so many civilizations have done so much for our world. So I'm not blind to that, but I certainly think that Iran is a land that has so much cultural and historical richness that is such a shame for it to be hijacked by fundamentalists.
Hmm. I appreciate that. So before we wrap up, would love to hear a little bit about what you're doing right now, what your practice is about. And you mentioned a few years ago you moved to New York City, which is a little bit different than Plano, by the way, on a couple of different levels. But would love to hear a little bit about your practice and your focus and what's driving you today in caring
Yeah.
for patients.
So we moved. I trained in New York City, and after training, we moved to Texas because we needed. My mom and dad later came from Iran, and they were there, and my wife's parents are there as well. So we needed the help. It was purely selfish. We need help, kind of a move. And then when the kids were a little bit older and we could move back, my father got ill, and I stayed through the final years of his life there. And
Mm,
then in 2022, we moved back to New York City. After COVID, my practice became purely aesthetic. I come from a family of artists. My mom is painter, and my father was a poet. My cousins play professional music in places, at Juilliard, and a lot of different kind of high end, not high end, but uh, highly rooted academic institutions for music. And so I fell kind of in love with the aesthetics of the human face more so than ever before, because I was doing all this reconstruction and seeing how it changes and how it works with identity, and a lot of not to bore you with this philosophical stuff, David, but kind of found a lot of beauty in human facial beauty,
mm.
and I
I
decided
love
that
that.
I would start to do that. And I am not a big fan of plastic surgery culture. I've never been that guy with the slick back hair and a pocket square, and I'm not. And I understand plastic surgery a little bit differently, perhaps, from the the predominant plastic surgery culture. I don't do things to beautify. I don't do things to necessarily rejuvenate. I see it more in a philosophy of I'd like my patient to find alignment between how they feel and how they see themselves in the mirror. I'll give you an example of how I even came up with that terminology. Is that when I was 30, my older brother, who at the time was 39, looked in the mirror and he said, "Oh my God, I can't believe my eyes are coming down." And I would look at the mirror, and at 30, I was completely aligned with how I felt. What was in the mirror was how I felt. Now in my mid 40s, what's in the mirror has changed from how I feel. Sometimes I see a photo and there's that lack of alignment. If that bothers a person, they should do something about it. Now, that thing can be internal or external or both. And if it doesn't bother them, then they should not be pushed by any kind of a social pressure to do something about it. And that is as basic as that is. That's my philosophy in facial plastic surgery.
I think it's beautiful, and I could feel from the entire time we've spent together now and when we met a few weeks ago that you lead from the heart, and it tells and any patient who's under your care would be very fortunate. How did you
Thank you.
how did you when you came back? I'm just curious for many of our folks that are listening. How do you even begin to start a new practice? I mean, you moved back a few years ago. It
Yeah.
seems daunting. How did
Yeah.
you go about creating a practice and then an identity around that practice that is authentic and consistent with your values?
Yeah. Well, it wasn't easy. That's for sure. And I'm glad I didn't know that when I made the decision to make the move back. Um, I came and scouted out a few spaces and finally picked one and signed the lease, and all the difficulties in New York City started. Now you need a permit. Now you need the Department of Buildings to do this. Now you need the inspection or whatever. 6 months later, we're still waiting. Luckily, I had kept my Dallas office, and I would travel back and forth to just be able to financially stay afloat.
Sure.
Um, and that also gave us this uh, possibility of being able to take our time a little bit and do things a little bit the right way instead of going back and forth and not have the pressure of, oh my God, I am here with all these expenses and no revenue. So that took about 2.5 years of going back and forth. Excuse me, 1.5 year going back and forth while we lived here, and then another like 9 months before we moved here, I was going back and forth to establish kind of a traffic. Now, patients come to us from all over the world.
Wow.
because and it's because of the I think it's because of I think there are a lot of technically excellent surgeons out there. There's also an issue of the style and restraint. I think restraint is so important. I say more no's to yes than yeses in my practice. And that initially may not be the right thing to do if you're trying to, start a practice and a business, but in the long term it is. And if you stay true, my dad used to always say the only way to run a good business is to run a good business. And if you stay true, you stay true. People aren't blind, people aren't dumb. People see through all the nonsense that the aesthetic industry is throwing at them, and I really believe that. And they see through who is doing it for what they think is the right reason. Who knows? Maybe I'll be proven wrong in the future. But at this moment in my life, I believe that for me, a well-adjusted, well um, somebody who likes themselves and is well adjusted and life is good and they don't have deep insecurities or deep troubles, but they have a little hump on their nose. They're 18, they're about to go to college, and this has bothered them for some time. It would be nice to get off. That's great. Compare and contrast that with a person in their midlife who now their marital spark perhaps is gone away or as the light has been dimmed, that they were bypassed for a promotion and the younger person got that promotion, or any number of things. And they've always been fixated on this nose. Now they come to me and they say, you know what, if I had this nose fixed, then all of these problems wouldn't happen because this is the main problem. Well, then you go and fix that nose. And of course, those problems don't go away. And they think that, well, you didn't do it right. This wasn't done
Mm.
right. If it was done because that, so there is a lot of psychology. I don't know if you remember this from medical history or not, but plastic surgery before World War II was called surgical psychotherapy. Isn't that
Didn't know
cool?
that. That's really interesting.
Yeah. Yeah. So there was no such thing as plastic surgery that happened after the First World War and concretized after the second. But before that, it was surgical psychotherapy. So it would be a general surgeon. There's something that's creating a psychiatric problem for the patient, and they would solve that. So uh, a lot of psychology there, a lot of, and this is why, David, I am so bothered by how the industry is pushing adult insecurities onto children. It's like they are getting them ready to be consumers of their skincare products in the future. Why are 8-year-olds lining up in Sephora and fighting over skincare, where they should be fighting over who rides the bike first or who's going to climb the whatever first, be out and play. I love this book called The Anxious Generation by Jonathan Haidt. He's a fantastic author. And I was reading in there about how social media has totally changed the game. You and I learned about social media. It was a tool that came later. Well, okay, we've had phones. We had to, dad would tell us to get up and change the channel because you were the person remote when we were growing up. You would only know where the party is by looking in the front yard and where the bikes are stacked up on each other. You wouldn't know otherwise. And social media came, and it was cool to watch these things and, have access to information and people and be in contact. But I know people that come to my practice that there was no world before social media for them.
Mm.
They cannot look at themselves in a mirror. They have to look at themselves in the selfie camera of their phone with a filter on.
Yeah.
The depth of lack of contentment with oneself is troubling, and it is all pushed onto these to our youth. And so we got to stand. I mean, who's going to stand up? If I don't do it, then who? If we don't do it,
It's
then who?
I'll have you back on the show at some point, but it's a fascinating subject because in my world, what we see a lot of and what I've seen almost an epidemic of is depression, suicidality, and also a lot of diseases that are functional. So children coming in with pseudo seizures or seizure-like activity that there's no organic cause. And most of us who've been in practice prior to and during and social media, the social media explosion, we now, I'm so sure, based upon that and the book that you just cited, that the anxious generation, that we social media is really causing a significant amount of damage to our to our children, and then these children will be ultimately adults. It's we're going to learn in the next, hopefully, few years how to
Control
change
it.
things, because it can't keep going the way it is right now. I think it's causing a lot of issues with our
Yeah,
children.
absolutely. Yeah.
So,
It's funny, 20 years ago, 10 years ago, maybe, I read somewhere that the number one cause of depression, I'm sorry, the most common STD in teenage girls is depression. Okay. Think about that for a second. Yeah. The most common STD in teenage girls is depression, because you do something out of a social pressure and then you fall into depression. Now, the number of STDs have declined significantly, and also the number of encounters, not necessarily in teens, but in young adults, have decreased significantly because we live on our phones. I think I think social media is what did the dinosaurs in. I mean, this is it. I don't know. Where are we going? Nobody's
that's
interested in
funny.
anybody. They're just interested in the reels and the number of likes and views. It's nuts.
Well, I knew I was going to enjoy this. This episode's going to be one of our longest, and I've enjoyed every second of talking with you. And
Me too.
want to thank you so much for coming on the show. And it's an honor. And part of this show for me is not the outcome, but it's the journey and the process. And one of the things that has been a tremendous joy is to meet colleagues like yourself who've overcome so many challenges in your life to get to where you are, and doing so many beautiful things and bringing honor to your family, both as a physician and bringing the creativity and, as you say, the poetry to the work that you do to help heal others. And I think it's beautiful, and it's an honor to meet you. And hoping we can get together when I'm visiting my family in New York City. I'd really love to
I look forward to that,
get
David.
together
And
and meet you personally.
thank you for this amazing podcast. I've gone back and listened to several of your episodes to
Thank you.
put humanity back into medicine. It's lovely, it's beautiful, it's what it should be, and you're doing it. So thank you for that. And thanks for having me, of course, as a guest on this show.
Well, listeners, if you're listening, please subscribe on YouTube, Spotify, Apple Podcasts, wherever you get your podcast information. And this is Dr. David Spiro. I hope you all have a great rest of the day. Bye-bye.
Thanks for listening to HUMED with David Spiro, MD. If you like this episode, make sure you're subscribed on Spotify, Apple, or your favorite podcast platform. The video versions are also available on YouTube. Make sure you subscribe and hit the bell there so that you never miss a future episode.